Okay, everybody. Welcome to this group case studies. I apologize for the delay. Can I just ask one of the people listening in to write in the chat if they can hear me okay and they can see everything okay? At the moment, Immaculate is having some problems with her microphone. She can hear us. So I've offered to read it through on behalf of the Kenyan government and also Immaculate herself. But she will be looking at the comments and the questions on the session chat and answering through that way. Okay, so this is a presentation about the barriers and enablers for severe wasting in Marsabit County in Kenya. Immaculate is the person who's put this together, and the program in Marsabit is is a leader in all of the counties in Kenya in this process, but they've also or many other counties are also dealing with the same issues. So we move to a quick overview of wasting in the county. For those of you who don't know Kenya, the green and yellow, the green areas are the less dry areas. The yellow and orange areas tend to be called semi-arid lands, and the red ones are the arid lands. And you can see that the wasting history of Kenya is affected by the dryness. Across the whole of Kenya, there's 4% of wasting, but in those red areas, it can go regularly up to over 30%, and more regularly over 20%. Immaculate, if I'm missing things that you wanted to say, please do write them in the chat, and people will be able to read them. So these are the graph on the top. You can see how for Marsabit things have changed since 2012. We have differences within Marsabit between the different sub-counties, with Saku and Moyale tending to be have lower prevalences of acute malnutrition, and North Horr and Lysimis having higher ones. But there's also more fluctuations in North Horr and Lysimis. And regularly, as I said before, you can fluctuate in North Horr and Lysimis between 10, 15, even up to 30% at times, although less so recently. And in Saku and Moyale, you're around 5, 6, 7% prevalence. So please come in, Immaculate. I'm really worried that I'm spoiling your presentation and all the work you've done. So a brief summary on the successes of the program in Marsabit, and as I say, in many other counties in Kenya, is that CMAM has been integrated into primary health care services. And over the last years, especially since devolution, there's been a much greater coverage across all of the counties, and in Marsabit, it's covering all of the health facilities. The coordination structures are very strong at national, county, and sub-county level, with very clear terms of reference, very clear guidelines on the coordination mechanisms. IMAM is adopted as part of HINI. HINI is a basic nutrition package of nutrition services that are offered through the different parts of the health system, and IMAM is very firmly inside of that list of services. The IMAM performance indicators are consistently within the sphere standards, and Kenya has regularly been one of the places where innovations and adaptations to the IMAM approach have been tested and then scaled up. To name a few, there's the IMAM Surge and the Family MUAC, but also the Combined Protocol and so on. And IMAM is a key strategy in national and county nutrition action plans. some of the enablers and barriers for the IMAM integration into the health system. The IMAM is anchored in the MCH program and leverages off the MCH financing and human resources. So there's been a gradual process of increasingly for IMAM to be integrated into the budgets and the human resource roles of the health system. Nutrition is a key cadre in the county and sub-county health management structure. And since 2013, Marsabit's a good example of going from 6 county nutritionists to 123 in 2021. And this is mirrored in several other counties. The nutrition commodities, after a long process, are now fully integrated in the essential medical supply chain and are supplied to all of the health centers through that supply chain with some support from UNICEF and the NGOs. And then there's a strong commitment to the community health strategy with the community health strategy development of a bill with nutrition fully embedded in the community health strategy. And then nutrition has, the nutrition indicators have been increasingly integrated into the DHIS. Move on. Great. So some of the enablers, there's a strong government ownership and commitment. There's existence of policy and strategic plans for nutrition, including IMAM. There's a strong technical capacity at the county, country and county level amongst the MOH and partners, and increasingly even at the sub-county level. There's food security and nutrition is one of the big 4 agenda for the national government. The national government has set 4 big agenda points for 2030, and food security and nutrition is one of them. And there's a strong public-private partnership for nutrition programs in Marsabit. The actions to capitalize on those enablers is to strengthen the systems to deliver further quality services. Innovations and adaptation to improve the access and coverage of wasting services, the continuation of this adaptation way of working, and a lot more advocacy for budget lines and allocations for nutrition within the counties. The barriers are continuous or persistent household food insecurity, frequent drought shocks, and minimal implementation of nutrition-sensitive interventions. The suboptimal infant and childcare and feeding practices and high rates of poverty and literacy. Immaculate, did your microphone just come back on? Maybe you could put it on to mute. Can you? Okay. Yeah. Okay. We can hear you, Immaculate. Do you want to take over? You do a much better job than me. I'll hand over to you.
Sorry about that. I can't see the shared screen, your shared screen, but I'm back.
All right. So
can I share from my end?
Oh no, I will just continue because time is going. But if you can interrupt me if I miss anything. Okay. So there's some of the actions now to address those barriers are to put a lot more emphasis. Already there's quite a bit of emphasis on multi-sectoral integration, including livelihoods activities, adaptation and innovation for shock responsive health systems, and strengthening community health systems. The recent adaptations have been the IMAM surge approach because of the frequent drought shocks. Now in Marsabit, 90% of the facilities are using surge approach, and most of them for several years. And there's 10 ASAL counties throughout Kenya. ASAL is the arid and semi-arid land counties in Kenya who are using the surge approach. and the intention is in the near future to strengthen the community linkages and to test the health part of the surge approach. The second adaptation is the family MUAC, which is also being implemented in 10 counties in Kenya, accelerated because of COVID. And there's further scale-up efforts to develop that even further now that it's up and running because of COVID. Okay, some of the commitments for moving forward, the Kenyan commitment to the WHO goals is to keep the wasting, WHA goals is to keep the wasting below 4%. The further integration of nutrition priorities into the county plans. The national nutrition priorities are already in a national action plan, and the idea now is to get them fully integrated into county action plans, and then scale up the innovative approaches of Family MUAC and CMAM Surge. But what's lacking is government's capacity and resources to go to scale, and they need further government support to support these service access through outreach. So outreach is a big problem. Okay, I'm sorry, Immaculate, if I massacred your presentation. That is all from me. We are also having problems with Frazer's web connection. So I'm just reading how we're going to do it. Finola, are you there? Do you want to just explain how we're going to get the video up? Over.
Sure, okay. So to find the presentation, if you could please navigate to the agenda and information.
Immaculate, I think your microphone, you should put it off. It's interrupting. We can't hear.
Sorry, everyone. So to find the pre-recorded presentation, if you can navigate back to agenda and information and ensure that the view past sessions toggle is on, so that should be blue, then you'll be able to scroll down, and you can, when you come back to this session's recording, the pre-record should be available. So that's going to be switched on in 10 minutes from now, so at 1:25 Irish time, and then you'll be able to watch the Ethiopia presentation, the pre-record from there. So I've put those instructions in the chat as well.
Thanks, Finola. Did I understand that there's a few minutes before we can go there? Shall I take some questions from the group and we discuss those? Over. Okay, I assume yes, please, is to give me some authority to ask those of you on the group, would you like to ask questions to Immaculate about the Kenya case study presentation? I'm sorry, as I was presenting, I wasn't able to read any of your comments. There's one here from Pat Mahone. So a question about, do we think that one of the barriers to wasting management is the lack of discussion about in utero programming, I guess, for acute malnutrition? Pat, do you want to come on and ask your question much better than me? Over. Okay, anybody listening in have any questions for Kenya? Can anybody type in any questions? Any of you from countries where, or from programs where you feel that there's something we can learn from the Kenya experience, and Immaculate can explain a little bit about what has happened in Kenya? You're making my job as a facilitator very, very difficult. I can see lots of my friends on this call. Can you please help me? Immaculate, can you try? Maybe there's something that I was presenting that I didn't bring out enough. Is there something in your presentation that you really want to highlight about enablers and barriers for IMAM integration? Over.
Thank you, Peter, and thank you for stepping up. Am I audible now?
Yes,
Peter?
We can hear you.
Oh, yes. Thank you so much. So what I can just put as a response for what Mark has asked, whether one of the barriers in the country and also in Marsabit for wasting is the in utero wasting. And I can say this is something that what is very certain in Kenya is that there is a lot of pregnant and lactating women who are malnourished. And of course, as such, we expect the children or the fetus to be compromised in the growth. But what we've noticed is that the new birth weights or the low birth weights are not as many as the children who are getting wasted after 6 months. So our biggest burden of wasting for Marsabit starts at 7 months, transitioning from exclusive breastfeeding to complementary feeding. A month, that's where we find.
Immaculate, I think your connection is loose. When you're playing with the cable, we lost your mic again. Can you just check your connection? We heard half of what you said, but not the rest. I saw you playing with the cable. Did that? No, you've disappeared again. No, I'm sorry, Immaculate. You might have to play with the cable again. Sorry. There is a question from Sonia about does the government cover the cost of therapeutic meals in our UTF in Kenya? There is some cost sharing, which varies at different times in the past years, but there has been an increased willingness to cost share on IUTF and therapeutic meals. I think I'm right in saying that. Is that right, Immaculate? Yeah, I can see you nodding your head. Are there other questions that you can put in the chat box? Perhaps you're interested in, is anybody, I'm not sure how to proceed here, it's getting difficult. There's another question from you, where is it? Okay, so I think what we'll do is we'll leave here, and if you can follow the instructions that Finola just explained, but also put in the chat, the session chat here, we can go to the Ethiopia presentation. And I'm seeing some other questions. So, Finola, once we've done that presentation, will we have time to come back or not? Over. All right. Do I have possibility to answer the question from Marie-Sophie, or we continue to the Ethiopia presentation? Okay, so I'll keep it short. Thanks, Marie-Sophie, for the question. Is the surge making the IMAM program more sensitive to drought emergencies? Yes, I think that the experience in 2017 and 2018 and even in 2019, as the drought started to hit, or people started to be aware that there was a drought coming at the Nairobi level, in the counties, the surge approach was signaling much earlier to the government and to the organizations supporting the government that something was happening, and that allowed some initial reactions to be made much earlier than the official
Sorry, everybody. We seem to have just lost Peter there. It seems that the technology gremlins have it in for our session. So I suppose if we'll stop the broadcast here for this session. So if you want to go to view the Ethiopia presentation, again, just the instructions are to navigate to the agenda and information, and then ensure that the view past session toggle is blue, and then you'll be able to scroll down, and this session will be you'll be able to view the Ethiopia presentation then. So sorry very much for all those technical difficulties, but thank you for joining us, and thank you for the questions that have come through, and we'll try to address those at some stage. Thank you very much.